This patient is about to undergo a breast reconstruction. It's an unusual operation in one key respect. The surgeon will bring an artist's sensibility to the science of the human form. This art class is no ordinary one. Its students are some of Australia's and New Zealand's finest plastic surgeons. Course convener Michael Esson from the College of Fine Arts at the University of New South Wales, an artist fascinated by both the form and frailty of the human figure.
I'm running a course which attempts to relate the notion of art and science, to develop and extend the perceptual skills of the surgeon and apply that to the theatre practice.
Well, I think it's necessary because we're working on three-dimensional structures. Humans aren't two-dimensional. So it's a particularly valuable lesson. Living tissue is not clay. If you take too much away, you can't just put it back. And it's not necessarily as pliable as clay. But the same principles apply. You know, you try to put the mass of the tissue where it's required in a reconstruction.
Surgeons know anatomy well, but surprisingly, they have very little art training. And this course is trying to parallel their practice and provide them with some experience that they can apply in the theatre.
Over a weekend, the surgeons are taught about drawing, contours, lines, and how a line can describe a shape. Using clay, they learn to mould a three-dimensional form. Another aspect of this advanced course is the notion of negative space.
We touched on that negative space issue in the preliminary course that I did. And because this is an advanced course, I'm trying to take it that little step further and applying it, in this case, to the whole body. And the investigation is to try and look at the spaces around the figure. And by, in a sense, ignoring the figure, we concentrate on the exterior forms, the exterior spaces. And if you do that, and you do that accurately, the form itself, the figure, will be magically there. When we were doing the wrapped up, I mean, it was really trying to get rid of the features, you know, the narratives, the storytelling aspect that somebody's got a nose and a mouth. And again, just looking at pure form, so that they were wrapped up with striped material, and that striped material was, in a sense, creating contour lines that they could sort of follow and provide the form by that method, so that when they might be cutting into the head or into the body, there's some sense of the direction of form. Some of the surgeons have told me that they now move around their patients a lot more than they previously did. And that is one of the very important issues, because so often when you see the operating theatre, the surgeon's placed on one side of the table, maybe assistants and so on, anaesthetists are surrounding them, etc. And they very seldom seem to move. The lighting is crucial in the sense that the lighting tends to flatten the forms.
I drove my anaesthetist mad because it requires running around the whole operating table and treading in their territory, standing at the bottom of the operating table. When you're doing, say, breast work, you need to elevate the patient so that the breasts drop naturally, and so this involves quite a lot of work for the anaesthetist.
You're reducing the aperture of your eye, and that tends to simplify the shapes a little bit and helps you sort of eliminate all the detail, both when you're looking at the object and when you're looking at your drawing.
Well, when you have a breast,
yes,
and you have to decide where the nipple is going to go, rather than measure it, you just draw it on, and then you slip your eyes and check.
So if you're reconstructing a breast.
Yeah.
Why? So who told you to do that then?
Well, I do it.
So I'm deciding how far the nipple should be from there, and you can mark that point. And then I would usually put another stitch here and get another reference point, so I can position it in space. Origami of the skin.
Mike believes being a brilliant surgeon does not depend on artistic merit. Nonetheless, he hopes the artist's influence lends valuable qualities to surgical practice.
That's been immensely valuable to me in learning to think in three-dimensional, in the third dimension, rather than just flattening everything out into two dimensions.
I think we we're trying to bring something other than just the formal aspects of looking at a head or a body, so that it's, there is an aesthetic formal consideration, but I'd like to think that the artist can approach that with some sort of degree of compassion, some humanity. So it's not just arranging a bunch of formal shapes. One has to be aware of the human characteristics of the head or the body, and not just look at it, as a series of forms.